Why do I think the IBD Registry is an important initiative? Well, many reasons, but ultimately I guess it comes down to patient care.
We really need to get the resources to deliver the best outcomes for patients. It's very easy to, when we're thinking about these questions at a national level, to forget that it's about individual patients as well, and a condition that affects every aspect of their life.
We spend a lot of our time getting what we hope is good quality clinical information to try and help manage our patients. The way we've always done this is that we write down that into a set of paper notes, and once you close those set of paper records, that information, no matter how good quality it is gone. It's a crime not to have that information available electronically.
There will be 3 different ways of entering data into the National IBD Registry. Obviously there's a considerable amount of data held already in legacy systems. The second way will be through a web-based portal which will contain the minimum data set. And the third way will be through the IBD patient management system, which we've spent some time designing and will have quite a bit of extra functionality beyond the web portal. The IBD Registry patient management system has been designed to make life easier for clinicians and their teams to provide optimal care to their cohort of IBD patients.
I started using the database registry in clinics, and it took me a little while to get used to, but now I find it very straightforward and logical, and now I'm used to the system and the layout. I know what questions are coming up next, so you can make it much more of a natural conversation.
We're at a fairly early stage using the UK IBD registry. So we're putting information in at the moment, and the greatest benefits will come as soon as that's complete. But already at this early stage, we've seen some significant improvements in our service.
One of the great benefits of having this system available to me in clinic means that I follow the same format of history taking as the doctors do. I follow the same symptom scoring. So when I enter the symptom scores, it's all perfectly legible and I can see previous symptom scores. I don't have to try and squint and read someone's indecipherable handwriting.
The system will capture data in a systematic way and make it available to the teams to provide optimal care. This will include a summary of the patient's care, the medications they're on, as well as a number of other different functions to support the team as a whole.
The registry is a really critical project as we see it to ensure that that solid foundation that has been put in place a number of years ago now is continued to be built on to ultimately benefit the lives of patients with IBD.
The model that we're using here of trying to collect national data on a set of patients isn't just right for IBD, but it could be right for lots of conditions. This new approach of working can be adopted across medical specialties. Patients will get a better outcome as a result. We'll know more about how patients are managed as a result. And in the case of IBD, we'll know more about the condition itself.
Our wish for the future would be to ensure 100% take-up, ensuring that patients get the best level of treatment and care wherever they may sit in the United Kingdom is absolutely critical.
So ideally, what I'd like the registry to be achieving in 10 years' time is that most clinicians who look after patients with inflammatory bowel disease will enter data as they see the patient, real time, which can be uploaded into a registry, but which delivers benefits to the clinician in terms of clinical information and ease of managing the patient, which delivers benefits to the patient in terms of improved quality of information, and which perhaps closest to my heart offers the opportunity to deliver the answers to research questions, and which kind of proves to people that the NHS is still offers the potential of being the best natural clinical laboratory in the world.